Welcome back. It's 10:13 this Monday morning. Well, did you know October was Dental Hygiene Month? You remember this? You know what this is. But we have Dr. Gerald Lawson with us in studio to tell us some ways to make sure our teeth are healthy and kind of explain to us some things that we just didn't even know that it could affect our health in other ways. Good morning.
Well, good morning.
Yeah, so I know what this is. I mean, I've seen this in the dentist's office plenty of time. Explain to folks at home.
Well, part of the problem with people going to the dentist is that they're afraid. This is actually a DentalVibe. This is an instrument that was invented by a Dr. Goldberg, and it takes away the pain of the injection. So the dentist paints some liquid on your gum and then lets it sit there for a while, and then you put this on the gum first.
Oh, okay.
And then while this is on the gum, it gives you the injection and you don't feel it.
And everything. Yes, I know.
So it kind of confuses the brain a little bit. So instead of the brain saying "ouch," it goes, "What is this?"
Yeah.
And then,
just the shock.
And
yeah. Okay.
And then it doesn't shock; it just vibrates. And then it takes. That's a big part of people's fear of going to the dentist. Something very primal.
Yes.
Pain avoidance. And these are amazing and your dentist will have these, but this is just an amazing way to get through the procedure.
Absolutely. Now, a lot of folks don't realize that if you don't take care of your teeth, it could lead to other problems, right?
Yes.
You'll be surprised at what you might hear here. Go ahead.
Yes. Well, it is amazing because everyone wants to go to get their teeth straight, or they want to make them look nice and white, or they want to feel young, or they want their mouth to feel clean, but there are physical reasons. The body is connected. The mouth is connected to the body, and bacteria and disease travels through the bloodstream from the mouth to the body. Illnesses, heart attack, stroke are increasing in a person whose hygiene is very bad. Relationship to Alzheimer's, relationship to many diseases from the mouth. So just keeping your hygiene, it's Dental Hygiene Month, and just having good hygiene is going to help your overall health, more than your appearance, more than having straight teeth.
Now, doctor, in your experience, what have you seen in terms of people maybe who don't take the necessary steps or just kind of cut back on things that they should be doing routinely? What have you seen in terms of the bad effects that it's done to their bodies or to their teeth in general? Have you seen them have heart attack? Have you seen that happen? Is that how often can that happen?
I couldn't actually say that,
Yeah.
but all the studies show it.
Okay, that is scary.
That they've studied people who are having a heart attack, stroke, and then they've just done the math, and significant numbers of them, they consistently find that their hygiene is very poor. Diabetes. My practice, it's almost as though there's an epidemic of diabetes going on. So many things ravage the mouth just from diabetes. You lose the bone that holds the teeth in. Just so many people on dialysis, so many people having problems. But there is a relationship. I just wanted to come and tell you that there's a relationship between what goes on in the mouth and the general health of the person.
Wow. Okay, can you give us some tips for folks at home, what they should do? Just little tips that they can do at home for themselves to make sure that they don't end up having a bigger problem on their hands later on.
Well, everyone understands that they need to brush. Everyone knows all the different types of fancy toothpaste we have now. Many of them do wonderful things. They will bleach the teeth, they'll whiten them. Many of them will eliminate the tartar from the mouth. And then you certainly want to floss at least once a day to get in there and get that. Some things you can't do yourself. So you really do need to see your dentist once or twice a year. Twice is better. There are physical problems that sometimes you just can't get it off. You know, it hardens in the mouth, and there are things that a professional can do that you can't do yourself.
Yeah, so absolutely see the doctor, go to the dentist twice a year if you can at least. We're going to put all those tips on our website at fox19.com. Thank you so much, Dr. Lawson, for coming in.
My pleasure.